Hello, and welcome to Next Generation Behavioral Health.
10-minute tips for modernizing patient care.
I'm Dr. Christina Armstrong.
And I'm Dr. Julie Kin. We are psychologists with the Defense Health Agency in the United States Department of Defense, and our team works on health technology to support service members, veterans, and their families, and the military healthcare system.
That's right. We also train clinicians on best practices of the use of technology in clinical care.
And today, what are we talking about, Christy?
Today, we are talking about podcasts.
This is a very meta episode. Do people still say meta?
Yes, well, I do, but...
Okay, that counts.
Yeah, so, we talk a lot about mobile health apps in clinical care, but I don't hear a lot of providers thinking of how to use other technologies to help support their patients. And podcasts are a really great way to get information out to your patients.
Yeah, absolutely. It just reminds me of where we were about 5 years ago with mobile apps when providers were just starting to realize that PE Coach, for example, could be a great addition to prolonged exposure therapy. And I think we're trying to get the word out that podcasts, just like the one you're listening to now, Next Generation Behavioral Health, are another great way to get information out there. They're the friend that you have with you when your hands are busy.
Yeah.
Folks listen to them in the car, while at home doing housework, between writing patient notes. It's just another great way for people who like podcasts or like this medium.
That's right. Julie, tell me a couple examples of how podcasts can help providers in patient care.
Well, one way, of course, is just it's a good way to distribute information, right? It's always faster to read something. If I give you a blog post or an abstract from a journal article, you're going to get that information pretty quickly. But the nice thing about podcasts is that you can have a conversation, you can develop rapport, can get a better sense of how to actually use that information in a nice conversational way. And for a lot of listeners, that's a better way to learn. But besides just learning and information gathering, some of the podcasts out there and the ones we're making are actually meant to help as an adjunct to care. So, for example, I know you're going to give me a chance to talk about these, but A Better Night's Sleep podcast is one that we're doing to give information to patients. We started it with Dr. John Olin at Fort Carson, and he said, I'm giving the same information to my patients over and over, and I tell every patient the same thing, but I don't know how well they're communicating it to their partner, or if they even remember it. So if we're able to put those information, those data in a podcast, then he can be sure that his patients have it and can listen to it on repeat. And the other podcast we're starting, the Military Meditation Coach, it's more than just information. It's the actual tools. It's actual meditation files that folks can listen to on their own, or you could even use those in session or in group therapy.
That's great, Julie. So the two podcasts you mentioned, I want to make sure that people hear the names of that. So you said A Better Night's Sleep is sleep information.
That's right.
And Military Meditation Coach, which is meditation recordings.
Yeah, let me tell you just a little bit more about them real briefly. And then I hope our listeners will check them out online. We'll provide the links for these and all the other podcasts in our show notes. But A Better Night's Sleep takes us just one by one through all the major sleep disorders and evidence-based treatments. We focus a lot on insomnia and, of course, nightmares and other common sleep conditions in the military community. But we also look at children's sleep, how to diagnose sleep apneas, what the treatment looks like. And then Military Meditation Coach is the other podcast we're producing. And we have a huge variety of meditation, mindfulness, and relaxation exercises. And they range from 3 minutes to a half hour. And they're pretty much every single kind of meditation you can think of. And the idea is we want to put it out there, and then the beneficiaries or providers can listen to them and see which one really hits the mark for them. So one other thing I just want to make sure folks know is that you can get both those podcasts the same place you get Next Generation Behavioral Health, on our website or pretty much anywhere you find podcasts. Same goes for the TBI Family podcast. Have you listened to that one?
I have. I've listened to a couple episodes and it's really helpful. The TBI Family Podcast was launched a couple of years ago by the Defense and Veterans Brain Injury Center. And it's a series of podcasts for caregivers and service members and veterans with traumatic brain injury. So each episode goes through information and resources and tips for caregivers and shares caregiver stories. And that's I think the most powerful piece of it. I mean, I feel like often the caregivers of our service members and veterans with traumatic brain injury, they often feel isolated. They're there caring for their loved one. But there's an entire network of caregivers out there. There's a lot of lessons learned and help that we can offer each other. And so that's the TBI Family Podcast.
Yeah, it's a fantastic podcast. It's really well made, very compelling, and the kind of thing that can help your patients feel like they're part of a community even when they're by themselves. It's just that linkage and that shared compassion is so important for the caregivers.
That's right. The next podcast I want to talk about, also developed by the federal government, is from the Uniformed Services University and the Center for Deployment Psychology. The Center for Deployment Psychology develops an entire suite of training materials for providers, and they also created this really fantastic suite of podcasts or audio files for providers as well. These can be found under YouTube. They're not available right now on iTunes. And so these podcasts are for military families on deployment. And some of the topics cover the DSM-5 changes, sleep, PTSD, and deployment experiences.
It's one of those podcasts I would recommend to providers who are new to the military community, especially. I think it's super helpful. And the fact that it's available on YouTube is nice because pretty much everyone can get to that site.
That's right. Even through our government networks, we're able to access it that way.
Yep. Let me talk real briefly about the TRICARE podcast series, because this is one that is great for providers and beneficiaries. It's available on tricare.mil, and we'll put the exact URL in our show notes as always, but it gives tips on how to access healthcare and also some of the latest updates in the military health system. So it's a pretty neat series to help you feel like you know what's coming over the horizon in our military health.
That's right. There's one other group of podcasts that I'd like to talk about, and these are a couple different suites of audio recordings coming out of the VA's National Center for PTSD. So the National Center for PTSD has two podcast series, one called PTSD 101 Curriculum, that's available on iTunes, and they also have one called Returning to the War Zone, also available on iTunes, and we'll put those exact links online because they're also available on their website as well. That same group also is involved in all the VA's mobile app development. So they also put out the VA Mobile Health Provider Program, and they also have a series of audio recordings available online as well. And so we'll be sure to put the URL into the show notes for that.
The bottom line is that podcasts are another great medium to share information, tips, tools, and resources. And every year we know more and more people are listening to podcasts. So I'd recommend just checking these out, just like with mobile apps. We always recommend dip your toe in, kick the tires, see what you think before you recommend it. All the ones we've reviewed here, of course, are made within the government, so we know they're reliable and good quality, just like our mobile apps and websites. So check these out and let us know if there's other podcasts in the federal government or elsewhere that you've found helpful. We'd love to know, and feel free to share them with us and other listeners on Facebook and Twitter at Military Health. You can join the conversation there.
Thanks for joining us today on Next Generation Behavioral Health.
Thanks for subscribing and rating us on iTunes or wherever you get podcasts. And please check out our other shows like A Better Night's Sleep and The Military Meditation Coach and the other great podcasts that we mentioned today.
Next Generation Behavioral Health is produced by the Defense Health Agency.